this country, about 5% of the population, or about 6 to 7 million people, suffer from diabetes. 90% of those 5 to 7 million people have what we call non-insulin dependent diabetes. In other words, they have a type of diabetes that does not require insulin injection.
Do you have any idea what causes diabetes?
Well, back in the 30s, it was demonstrated that if you have a lot of fat in your diet, that the fat causes the insulin that is being produced by the pancreas to be insensitive. So basically, because the American diet is so high in fat, we eat food which blocks the sensitivity of insulin. Many of these diabetics, John, actually have an elevated insulin level in the blood, along with elevated blood sugar, which is like a misnomer. But in reality, because of their obesity and because of the high fat in their blood, the insulin doesn't work and the blood sugar level goes up.
Would you expect that people who eat lower fat diets in other parts of the world are going to have less diabetes?
Not only would I expect that, but that is exactly true. You take countries like Japan, or particularly countries in Africa or the underdeveloped countries which are eating primarily carbohydrates, low in animal protein and low in fat, diabetes is not only rare, it is almost unheard of.
Now, what you're telling me is that we can prevent adult-type diabetes by staying away from the fatty foods. What if we take somebody who already has diabetes, an adult diabetic? What if we changed them to that other kind of diet, that low-fat diet where diabetes is so rare? What would happen?
Well, that's what we've been doing. We've been doing that for almost 15 years, where we'll take the obese diabetic and put him on a low-fat diet, exercise regimen, and in those you can get about 80% of them off of insulin if they're taking insulin. And if they will follow the regimen continually, the tendency towards diabetes will just be eliminated in 80 to 90% of those individuals that follow the regimen.
How about the patients? Do you think if they knew about this option, they'd do it?
Now, we're dealing with human beings, and when you ask people to make changes, you know and I know that sometimes they'll make changes for a while, and then they'll backslide, and they'll remotivate, and they'll rededicate. But in general, what we try to do is to offer them the best approach so that they understand that there is an option. Then they can take more responsibility for their care, more responsibility for their health, more responsibility for their success, and they're not kind of tied to a paternalistic system where they check in regularly just to get medication.